Welcome, everyone. I'm Dr. Claudia Cotca, of course, founder of Global Leadership in Dentistry and Sciences. I'd like to invite our global ambassador, Christa Serban. Christa Serban is not only the global ambassador for GLDS, but also an intern with the Washington Institute for Dentistry and Laser Surgery. And of course, she's in her final year DDS candidate at the Victor Babesh University of Pharmacy and Medicine in the School of Dentistry there. So with that, I'd like to welcome Christa to spring us forward for this particular symposium.
Hello, everyone. So I will give a quick introduction about Professor Claudia C. Cotca, who is a DDS MPH, is an internationally recognized lecturer, USA expert with ADA, SCDP, AAMI, ANSI, ISO, IEC, ITU, AFDO, healthcare analyst, dentist, and toxicologist, founder of various ventures in private and public health, with expertise in innovation of clinical protocols, medical devices, global laser technology, clinical applications, and oral systemic axes, global healthcare sector intelligence, healthcare policy, and expert witness before USA Congress and White House. She is appointed at rank of professor at Liberty University School of Health Sciences and international research collaborator with the Dental Research Center using conventional and alternative technologies, Victor Babesh University of Medicine and Pharmacy, Timișoara, Romania.
Thank you so much for that. I'd like to congratulate Christa for doing an excellent, really overall comprehensive thread of contribution from, of course, promoting and increasing visibility for GLDS across the globe, and also, of course, fostering participation collaborations for interested, particularly young professionals in the health sciences, not just dentistry, but also extended medical specialties, subject matter expert, that is. And so I'd like to congratulate her for her contribution and for her leadership. I would like to welcome all the GLDS ambassadors. Khadija, welcome, as well as those trickling in. Welcome to another GLDS symposium. As you know, this is going to be again on policy. We're really fostering, I would say, an exchange and arbitration in terms of the basic concepts of what policy really stands for in a particular geo-position. And by this particular conversations, of course, is going to be in the Washington, DC area of government, which is the USA model, but of course, a lot of diplomatic, historic contributions and collaborations across the globe with their respective geo-positions, particularly on healthcare. And with that, we have another contribution from our board of directors member, the Honorable Scot Faulkner. And he's coming in again to us from Washington, D.C. This is not his first time here on the platform. And I'd like to just give a quick reference to some of the many contributions that the Honorable Faulkner has contributed, not just to the United States, but also across the globe. He was the first chief administrative officer in the U.S. House of Representatives. His business-based reforms rebuilt the integrity of House operations, as well as generated sustained savings of $4.5 billion US dollars. These reforms became a model for the operation of 44 national parliaments around the world and were named one of the top 100 innovators in American government by the Ford Foundation and Harvard University. Private sector experience includes serving as global practice leader for the American Management Association offices in Bangkok, Brussels, Buenos Aires, New York, and Tokyo, and of course, vice president of Philip Crosby Associates. He led strategic transformations for major global corporations, among them Congra, Hershey, Qatar Petroleum, and the Australia-New Zealand ANZ Bank. Earlier, he was a director of personnel for the Reagan campaign, served on Reagan's presidential transition and the White House staff. He had positions, executive positions at the Federal Aviation Administration, the General Services Administration, and the Peace Corps. His public sector accomplishments were recognized with 26 management awards and 4 letters of recommendation from the President of the United States. There are many accolades that we can list, including his book, of course, which is the memoir Naked Emperors. I suggest that everyone who hears about it get it and obtain it. And he, of course, last but not least, earned a master's degree in public administration from American University, which is right here in Washington, and a bachelor's degree from government from Lawrence University. He studied at the London School of Economics and Georgetown University, which is also in Washington, D.C. And with that, I'd like to welcome again the Honorable Scot Faulkner.
Thank you very much, Claudia. So today, we're going to talk a lot about what's happening in Washington and what is about to happen. But the main theme is a term I coined back when I was with Reagan, which is people or policy. That you can talk about all the policies in the world, you can talk about all the procedures in the world, the legalisms, but it's the people themselves that make things happen. And that happens whether it's at a practice level, any kind of team level, any kind of organizational level. But people, you get the right people around the table, you give them the right guidance, you give them the right tools, and good things happen. If any of those things misfire, bad things happen, or opportunities are missed. And so we're entering into a situation in Washington where the people component becomes critical, because on November 8th, we're having what we call our off-year election. 2 years into the Biden administration, the entire House of Representatives, which is 435 voting members, 4 non-voting members, places like Puerto Rico and Guam and some of places like that. And then the third of the U.S. Senate is up. They rotate every their 6-year term. So you're going to have new players. In fact, right now we have a record number of retirements from the House of Representatives. 55 people have chosen not to run for re-election in the House. Now, some of them, a good example is Congressman Tim Ryan, who's a very senior member from Ohio, is running for U.S. Senate. So some of these people are retiring to run for other offices, governor, senator, whatever. They may or may not make it, and that's what our elections are all about. But to have 55 people, some of them very senior, some of these are people who have been chairing health-related committees and subcommittees and caucuses for many years, are stepping down or try to step into other positions. So that means that no matter who wins November 8th and which party is in control of the House and the Senate as we come into January 3rd of next year, they're going to have new players. And that means new people. And that means elected people who are going to come into these offices and onto these committees. Since you're in college, you've been through college, think of what's about to happen after November 8th. Basically, Congress comes back into session November 14 to 18, and then the first couple of weeks of December. And think of it like freshman orientation or freshman week, coming in as a new student to a college. They actually get to pick committees, they get to pick their staffs, they get to pick their offices. There's actually an office lottery where members get to pick which office building they want to be in. And there's many reasons to pick an office in one of the 3 major congressional office buildings. Could be they want to be closer to their committee rooms once they get their committee assignments. In one case, a good friend of mine, he was the son of a previous congressman, and he opted for the same office that his father had. And so these are interesting times, because when people, again, think of these members, some of them have held other elective offices, some of them are in their 50s and 60s, and yet they're coming in like a college freshman into this campus, which is the Capitol Hill, and getting to pick their offices, getting to pick their staffs, getting to pick their committees. And so lots of variables. And when you have these very senior members of the Congress retire as chair people of these committees and subcommittees, that means the next person in line moves up. And so a person who may have a set of interests in one particular part of the health environment, it may be completely different when this next person steps up. And certainly if we do have any change of parties in either the House or the Senate, major changes in terms of direction, in terms of attitude, in terms of tone, everything could change in a big way, especially since more years from now, 2024, the presidency's up. So a lot of people are going to start positioning on policy fronts as we move toward picking a new or retaining the president in 2024. So another piece to this is that, getting back to the people component, the normal member of Congress has about 12 to 14 staff people. And some of those people are in Washington. Some of those people are back in their district offices. And so every member of Congress gets what they call a clerk hire allowance that allows them to hire as many staff as they want. If they hire more staff, they can only pay them so much. So some staffs are less paid, but they may have 18 people on their staff. In the Senate, each congressional district is technically the same size, except for like the at-large position of Alaska and some of the bigger states that have very little population. But in the Senate, we have the wide range of states with very little population, states like California and New York that have huge populations. So the staff for a senator can range from like 20, 25 people up to 50 people. And so once again, who they pick, are they picking people with expertise and interest in a particular range of issues in health or in defense or foreign policy, budgets, whatever, or are they picking people who may be related to one of their donors or someone who comes from their state or from their district in some way that gives them that perspective of the people they actually directly serve. So people become important, especially when you got a new member of Congress, a new senator coming in. They're going to bring people from their state with them who may be coming to Washington for the very first time. They're finding housing. They're trying to find a new dentist. They're trying to find a new hair cuttery or whatever. And so they may have served on this person's staff in the legislature. They may have been with some of these times, especially people running for Senate, may have been a governor, may have been a very successful business person. So they may bring people with some interesting backgrounds, but again, none of them necessarily having the background of Washington and how policy works here. So what happens in those first few weeks between the election and literally Christmas, we have orientation. When I was CAO, we actually developed the first virtual orientation where we gave every member on the House a laptop, and it was loaded with all sorts of online tutorials on how Congress worked. And we let them access online databases. We actually worked with our National Security Agency to create a rotating, like every couple of seconds, PIN number. So it would be a very secure interaction so that they could go and access government records in a secure way. And so members and their staff start to learn. And there's actually Harvard University, Kennedy School of Government. You have something called the Congressional Management Foundation that actually run tutorials, run several-day seminars to teach people how to be a member of Congress, how to be a senator, how to be a staffer. And so again, we're some very interesting learning curves take place. And this is also a time when interest groups kind of do what I call the welcome wagon, that they will hold receptions for the new members. They will hold their own training that will focus on specific issues of theirs, like in some think tanks like the Heritage Foundation, Brookings, and some of these others will hold maybe more ideologically focused briefings and trainings versus the more objective ones where just how do you answer constituent letters, how do you move bills to Congress. Then we're into the committees themselves. Every committee has staff, a Republican staff and a Democrat staff. Right now, because the Democrats are in charge of both House and Senate, they would be called majority staff, and the Republicans are the minority staff. So usually in these situations, the minority party has about half the number of staffers that a majority party has. And once again, we're into an interesting spectrum. We have people who literally have maybe spent their entire professional lives on the Hill, where they have been there 20, 25 years or more. And they are literally considered the go-to expert on tax law, or on how the budget works, or on homeland security, or on defense procurements, or whatever. And so in some cases, these people are retained no matter who is the chairperson of that committee or subcommittee, because they are literally recognized experts in their field. You also have then people who are going to come in that are going to be much more ideological and tied to the party that's hiring them. So you have this incredible churn. You have about 14,000 employees in the legislative branch, and about a quarter or more are actually in the districts or in the states. The rest are here in Washington. Another piece to this puzzle is that we have various, again, this gets back into some of the technical committees that oversee things like our Federal Aviation Administration, or the Defense Department, or health issues like NIH, our National Institutes of Health, National Science Foundation, where literally these agencies will basically detail, or in Europe, second, staffers and experts from their agencies to act as liaisons on these committees, because these committees have oversight responsibilities, not just funding and creating policy for agencies like the National Institute of Health, but actually overseeing their direction, and how was the COVID pandemic handled, or whatever. And so for many of these members who have to now become conversant, if not experts, in a range of issues, from agriculture subsidies to, again, a new weapon system for defense, to again, the next pandemic, these experts are vital, because you don't want people just coming in and just sort of reading stuff off the internet. You want to have people who have people behind them that are helping draft the legislation, draft the speeches, draft the questions that will help hopefully move government forward in useful, value-added ways. So it's all about people so, from the election on down.
I want to catch up on the point that you very eloquently, delivered comprehensively. And what we want to do, we really want to illustrate, a comprehensive macro view, but also with the micro components of participation that are very, very key. Whether it's in a geoposition like United States, or an open market like United States, or whether it's another geoposition that's a different atmosphere nature. And what I'd like to do is bring it very, very relevant to the healthcare experts. And I remember back in 2001, about or so, when I was first exposed to the congressional steps, and I was surprised to see that the congressional members are very interested in being educated or informed by subject matter experts. And I think that irrespective of where the accolade lands, whether at the United Nations, or the European Union, or the USA Congress, or the Singapore government, regardless, the encouragement is to, and I'd like you to just comment very briefly on that. The encouragement is for subject matter experts to have the I would say perspective of taking initiatives to actually contribute subject matter expert, and to understand that no matter the level of the vertical position, it is actually they themselves are key stakeholders of information that is absolutely key for the participating backdrops of intervention, whether it's from the government or the policy regulatory aspects. So please comment on that in terms of approach to a geoposition like United States, and how it's done here, as well as something that could be obviously extended. You have a global experience in that.
Oh, sure. And again, I mean, we're seeing some very interesting changes in England. I mean, the Queen Elizabeth, before she passed, met with her 15th Prime Minister, and so you have a major change, swapping out of ministries and other leaders within the Conservative Party that runs the Parliament there in England. And so, and again, all of you are from countries that, in many cases, have your own parliament, have your own elections. And so, once again, I think the U.S. probably more than many other countries has a much more staff-heavy environment. mean, have several friends who are in the House of Commons, and if they like share like one person, and then they're really dependent on the experts that tie to the standing committees because they don't really have people of their own. And so but it's back to the issue of people. And so this subject matter expert, I love the acronym SHME. So for SHMEs, there are three things that you really need to do as a SHME. One is aggregate information, curate that information, and disseminate the information. And Bybee, who's was a major thought leader relating to the information age going back 20 years, called them infomediaries, where any one of these issues we talk about, whether it's in health, defense, finance, or whatever, you could literally open up a fire hydrant and just be drowned in data, drowned in information, drowned in perspectives, and even and differing viewpoints. So people are going to turn to people who they trust or grow to trust. Say, give me the critical few. I've got a bill coming up, or I'd like to have input on behalf of my constituents on this particular topic. Give me the critical few data points, the critical few case studies, the critical few best practices that I can grab hold of and craft into a speech, into an amendment, into a piece of legislation, into a hearing. And when I was the Associate Administrator for Government Industry Relations at the Federal Aviation Administration, I always viewed a hearing as like basically a theatrical event. It's a play. And so the first thing I would do when we'd talk to our committees, oversight committees, is literally sit down and craft the play. What are we talking about? Are we talking about a specific part of aviation safety? Are we talking about a new air traffic control system or whatever? And what's the outcome?
Sorry, Scott, something like an executive summary. And so you're basically encouraging the preparation of having something that you can actually not only already verbalize very readily during the exchange or during the introduction or the opportunity. And it could be as short as a 1 minute, opportunity to give a handshake and to say, this, that, and the other, at the same time, handing over a piece of paper to saying, please read further, and this is where I can be contacted along with the business card. Please comment on, these grassroots elemental skill sets that really need to be ingrained in subject matter experts' opportunity to contribute.
Absolutely. I think, well, the one thing to remember is that these members, elected members, House and Senate, are very busy people. They're being tugged in so many different directions. So this is something, especially in this whole area of light therapy that Claudia and I are involved with. We have the science environment. You write a 30-page paper, research paper, and it has lots of footnotes, and you have the abstract and all that. Nobody, even some staffers, are probably not going to read that. So they're going to want a one-pager with bullet points that gets to and I've used this term, I think, in previous discussions, with what's in it for me. Why should this member care about this? Why is this issue important to the member or his or her constituents? And what does this paper, what is it giving them to take some form of action, whether it's to pose a good question or, again, create an amendment, create a piece of legislation, whatever it takes. And so the shortness, the succinctness of writing and getting to the point and also the best SHMEs are ones who basically get into the heads of the people they're advising. Say, okay, this person is really interested in this issue, or this person is data driven and I need to give them lots of statistics, or this person is personal story driven. I need to give this person examples of a patient who has benefited from this, or a veteran at a veterans hospital that's benefited from this. And so to make the facts and data, give it a human face, make it come alive. And so that interaction is critical. I mean, when I would sit down, I've been on both sides of members coming to me and me going to members over the years on different issues, sitting down and looking at that outcome. What are we really, at the end of the day, what are we trying to accomplish? Define success for you. And once we have that locked down, we say, okay, now how do we get there? Especially, again, back to the issue of hearings. You're building a public record for something, either to expose an issue, inform it on an issue, or change something relating to that issue. So again, it's back to a theatrical event. The members are asking questions and making statements. The witnesses are making statements and answering those questions. And so we would literally create books where we'd say, okay, member one is going to ask this question, and here's our answer. And so when I'd sit there with the administrator of the FAA, I'd say, my goal is no surprises. And I would sit down with the members and say, you can come up with a gotcha question, but all we're going to do is say, Congressman, we'll get back to you in writing on that. And at which point you are deprived of the soundbite at that hearing. So if you give us the questions you're going to answer, you're going to ask, we're going to craft good questions, and we'll have those moments where the public record is established, either for information's sake, oversight, or for building a case for some change. Sure. So this is really, so the interaction, again, back to people, and it's the people skills.
Yes.
If you a SME that is open and humble, and being able to go in and say, I'm here to help. I'm here to help you get to the finish line that we both think about. Okay. One quick example, Senator Metzenbaum, who was one of the more irascible, angry with the world kind of members when I was at the FAA. He was a Democrat, very liberal Democrat. I was, of course, part of the Reagan administration. And I sat down with him. The first thing out of my mouth, I said, Senator, you and I are on the same side. And he kind of got back and said, what do you mean we're on the same side? I said, we both want to make sure that everyone who steps on a plane steps off that plane safely. He kind of went, oh, I hadn't thought of it that way. And so, we said, now let's talk about aviation safety and how we work together. And so breaking through those barriers, building those relationships, and again, building the trust. And so it's a lot of different pieces, but again, for people like yourself, how do you do the research? How do you aggregate that information? How do you curate it, boil it down into something meaningful, and then disseminate it in a way that actually promotes action and validates action? That's really, what you're going to be called upon to do as you move into the sphere.
So that's really key. And I was going to ask you for the conclusive, essentially highlighted, but you've done it, and you've gone back through circles. So thank you for that, Honorable Scot Faulkner, for joining us. I'd like to just remind everyone, of course, GLDS is not just for the young expert subject matter or the, or the student subject matter that is basically, journeying through the academic experience, but also, of course, for the seasoned subject matter who is engaging continuously or is starting to have interest in contributing subject matter expertise in the 360 healthcare axis as healthcare commodity space demands services and products and treatments in healthcare. And so I'd like to just remind everyone that I myself stepped on Capitol Hill as a student, and I certainly was not experienced nor in academic or I would say experience form as you've heard today and you've heard prior. However, the initiative and the, I would say, a humble reflection to say, this is what I know. This is what I know with, with backup and preparation and networking and information and engaging and extension and finding the common threads. And really what you've been actually brought here today it's quite strategic thought if you listen to things carefully in what the Honorable Faulkner has mentioned to us today. So a lot of pearls of wisdom for parallel contributions, not in just, one particular geoposition, but also across the globe. And of course, we're here to improve healthcare productivity and particularly the integrity of healthcare transactions wherever you are. With that, I'd like to say goodbye to you and we look forward to seeing you at our next symposium.